Good morning, everybody. This is Mahmoud Alatari. I have been the Senior Director of Industry and Insights with Oracle for 5 years, working across the SaaS portfolio and ensuring alignment to the healthcare industry requirements. I bring 20 years of healthcare and life sciences industry experience and expertise in the areas of clinical transformation, EMR, ERP, revenue cycle management, health information exchanges, and health insurance systems and exchanges. I am passionate about the innovation and the value that emerging technology brings to the reinvention of the healthcare industry. I'm so excited to be speaking with you today, and I will be speaking about some of the lessons learned and experiences of establishing a resilient healthcare organization. As most of organizations and societies across the world are starting to recover from the impact and the massive disruptions caused by the COVID pandemic, we all learned a hard lesson about the importance of establishing resilience, and the new term resilient organization have become commonly known. So, what is a resilient organization? According to Gartner's definition, resilient organizations are those that rebound and prosper after business disruptions because they are resistant to the impacts of disruption as well as adaptive, elastic, and sustainable in the face of disruption. Now we learn that resilience is really about agility and redundancy. And with redundancy, I mean the redundancy across your business processes, human resources, and capabilities, and not only limited to the common term of technology redundancy. At the same time, agility is also key. It's all about our abilities to adapt and change to respond to these disruptions. And in the coming few slides, I will discuss in more details the principles of establishing a resilient organization. Now, based on our experience with healthcare customers during the pandemic, after and before, and from across different regions during the last few years, we learned that resilience, excellence, and even significant transformations can be accelerated and achieved within a very short time frame and over a span of weeks and sometimes days in some situations. One of the examples, in Oracle, we assisted one of the leading US state departments to transform from an inland revenue tax contact center to a COVID-19 help center within 5 days only. However, now from a holistic point of view and a bigger perspective, we learned that to be resilient, you need to establish your transformations across 6 major dimensions. The first dimension, and as we all experienced, is along the model of care reinvention, the ability to change and adapt to specific disruptions. As an example, during COVID, we've seen many hospitals and public health organizations establishing strict infection control measures and reinventing themselves. So, as an example, some of them have classified locations and some hospitals as dirty and dedicated these hospitals only to the treatment of COVID-19 patients. Others were classified as cold, and cold hospitals are the ones that continued delivering non-COVID services to lower risk patients. The other area of transformation is the one for digital technologies and the adoption of digital innovations. Traditionally, we all know about the electronic medical records. During COVID, governments all across the globe accelerated the adoptions of innovations, and telemedicine, as an example, which was a restricted healthcare delivery channel in many countries due to regulatory constraints, have been completely accepted and introduced to be a major delivery channel to healthcare services. We've seen also the deployment of robotics, and we've seen many robotics becoming mainstreams. We've seen some robotics in action. Some were used for disinfection, as an example. Other robots have been used within hospital for the delivery of medication between the different wards and departments. Supply chain is another area of resilience. And I'm sure all of you have witnessed some form of supply chain disruptions during the COVID-19 crisis. Some countries has introduced restrictions on the export of some medications and medical materials. Delivery, shipping has been restricted as well. Many of the personnel that work in the shipping industry and that's being or the transportation industry all across the board, be it by air, sea, or land, have the availability of these resources have declined significantly, which caused significant disruptions to supply chain. And this has led us to really looking into establishing capabilities for redundancy in our supply chain and not just following the traditional model of just-in-time supply chain. Now we are looking into diversifying our sources of supplies. We're looking at diversifying our channels of supplies, and we're looking at many other measures that I will be elaborating a little bit on further in the coming slides. We see new concepts emerging. I'm sure many of you have heard about clinical command and control centers. Clinical and command and control centers are now being adopted both at a provider level and at a national or health system level. Command and control centers are capabilities introduced either by hospitals or healthcare systems to monitor specific key KPIs and aspects of your performance and provide you with the ability to promptly react or replan or take any specific actions in regard to any significant changes to any of the metrics that you monitor. It might be, for example, inflow of patients, availability of supplies, or, for example, a case of a crisis in a specific area or region within a healthcare system. The fifth dimension, and it's probably the most important of all, is our people. And it's really about engaging, it's about protecting, it's about skilling, training, and retaining our frontline defenders, our healthcare workers. And finally, project management capabilities and having the project management resources are really key to be able to manage and deploy these critical projects promptly and swiftly. And it is one of the key enablers for agility and transformation during any crisis and even during, I would say, times of peace or steady operations times. So now, digging a little bit deeper into resilience, I'm going to talk about three major areas of resilience. That is the financial resilience, supply chain resilience, and human capital resilience. And those are probably some of the most critical areas for really retaining your capabilities to operate during crisis times. Financial well-being for healthcare organizations is, of course, one of the most critical factors for maintaining the quality of services to patients. And you need to always and almost always have sufficient funds available to meet the organization's clinical and non-clinical needs. In crisis situations, probably most healthcare organizations will face situations of really accelerating cash burns while patients are slowing the payments and suppliers are also seeking faster payments. In such situations, defensive cash preservation and cash generation tactics are really of very critical importance. Now, according to a paper published by KPMG, I believe last year, they recommended that organizations have to always set up robust short-term cash flow forecasts. And that should be set for at least 13 to 17 weeks And this needs to be done at the business unit level and the group level. And you always have to review your cash situation almost on a weekly basis, and in parallel, assess the enterprise-wide cash flow risks to spot really potential downsides and identify rapid ways to reduce these costs or cash burns to preserve your cash. To be able to take these kind of measures and to decide on what cash measures you should take, CFOs and financial managers need to do stress testing, and they need to do that with different financial models, perform several types of analysis, sensitivity analysis, for example, against various scenarios and factors. The CFOs and financial managers also need to have the really deep insights and information available at their fingertips to look at their organization from a financial perspective, and have to, for example, if in a certain situation they decide to mothball, and mothball is a term used in finance, and what it really means is to freeze non-critical and non-core capabilities. They need to have the information to know which capabilities they can mothball without impacting the organization, or without having a significant impact on the core business needs of the organizations. They need also to have the ability to take the steps to preserve cash balances by probably trying to negotiate better payments or restrict payments only to the most critical vendors or partners or organization or projects for that specific organization. Now at Oracle, we are proud that our financials and back office cloud provides our customers with the flexibility and the abilities to enable them to have a comprehensive organizational view. And it enables every department to have its own insights, and it also enables centralized decision making, where it would enable all of the sub-organizations or sub-departments to work together to plan and forecast and run the simulations and the different, I would say, scenarios with a sensitivity analysis to make the best decisions to deal with crisis situations. In addition, our financials cloud has been also augmented with artificial intelligence capabilities that enables CFOs and healthcare decision makers to almost promptly develop scenarios for managing liquidities, for scenarios for performing sensitivity analysis, for example, against different funding scenarios, and also help them with establishing the proper contingency measures to respond to crisis. Now, moving to supply chain, again, as I said earlier, we learned that establishing redundancy in supply chain is very critical to sustain your operations at all times, at crisis times and steady operations times. And what we've learned from our customers for the establishment of resilience in supply chain, you need to look into 5 major areas. The first, you need to establish network agility. And by that, you need to have the ability to react quickly to disruptions and to be able to re-network your suppliers. We've seen many examples, for example, in the region or across the globe as well, of countries looking at new scenarios of near sourcing. And by near sourcing, I mean the manufacturing of certain equipments or consumables in country almost promptly in response to the crisis. or maybe re-network your supply chain to find other suppliers that are more reliable or can be used as a backup during these situations of disruptions. Digital collaboration is also key. Cloud-based supply chain applications and platforms and tools are really key in terms of sharing information. They improve the speed and the quality of decision making within an organization and also with your partners and suppliers and external partners. And this is really key during time of crisis where everybody has to be informed almost immediately on the variations or on the new information that is happening during the crisis. Thirdly, network visibility, where you would need to have almost real-time visibility into your network. You need to have the data all across the supply chain. We are seeing the introduction, and now new capabilities are becoming mainstream. Capabilities like, for example, track and trace, or the use of blockchain technology. And this can give you an almost instant visibility into the let's say, for example, the location of your shipment and maybe even the condition of your shipment, whether it's been handled properly, whether the temperature variations are within the acceptable limit or any other metrics that you might be following. Fourthly, of course, the ability to generate insights. And this is absolutely crucial to always stay ahead of your supply chain disruptions and having the ability to rapidly analyze the data and react to it. And these analysis can even go beyond the standard supply chain analytics, and you might integrate, for example, weather data or any other critical elements of data from external factors to give you the true visibility into your supply chain situations. And finally, we've learned that empowering your teams and empowering your people is really key. Decentralized teams, empowered teams can react almost immediately to the insights that are generated by these advanced analytics and create rapid recovery, let's say, plans, or can make the decisions to avoid a certain crisis or situation immediately without the need to go through a long bureaucratic process. If complete empowerment is not possible, then the sharing of the data, the availability of the data, and the instant access to the data. For example, if a certain decision requires an approval, then the approver should be able to see this requirement on his mobile, as an example, and make a decision immediately. In Oracle, we believe in clinically integrated supply chain. We have introduced all of these capabilities that I've just spoke about within our supply chain modules, and we are a big adopter of emerging technologies. We have established and enabled all these capabilities almost intrinsically within our SaaS cloud. Now we talk about our most important asset, and that is our front-end protectors, the healthcare workforce. As a start, ensuring the safety and wellness of our healthcare workers and support personnel is of utmost importance. The availability of personal protective equipment is critical, as well as training our healthcare workers on how to use them and how to use them correctly. In addition, providing social support within teams, families, and friends, along with the information and guidance to our healthcare workers on how to deal with stress and post-traumatic stress needs to be an integral part of a resilient healthcare system. Now, in terms of workforce allocation and staffing, we all know in emergency situations, healthcare workers are required to work under irregular and sometimes atypical conditions. And many healthcare workers are facing heavy additional workloads, along with very long working hours and a lack of rest periods. Therefore, there should be an appropriate work time arrangement to help healthcare workers balance their services requirements along with their care responsibilities at home and their own well-being. In addition, training and the development of educational resources for employees in high-risk occupation, and by employees in high-risk occupation, I mean the ones who serve the public during emergencies. Having the ability to train them and reskill them to protect themselves and others is very critical. And a resilient healthcare organization should have the tools, the systems, and capabilities to respond to emergency situations. Healthcare organizations need to have the capabilities that enable them to recruit, deploy, and retain sufficient number of well-trained employees, healthcare workers, and support personnel. The COVID-19 pandemic once again underlined to us the urgent need for a strong healthcare workforce. And this is really an integral part of every resilient healthcare system. And this is now recognized as an essential foundation for the recovery of our societies and economies, and also to ensure our preparedness for future health emergencies. Now, in terms of remote working, probably I do not need to stress the importance of having the capabilities to deliver healthcare services remotely. Telemedicine is now recognized as a mainstream healthcare delivery channel. Resilient hospitals nowadays are taking advantage of cloud technologies to deliver healthcare services remotely. And effective human capital system is really one that can completely connect every human resource process to you from hire to retire. And this should include your HR processes, talent management capabilities, workforce management, and payroll. It is really the platform that connects the entire healthcare organization, and it should provide you with a consistent experience across devices, and it should promote and nurture collaboration within the organization or within the ecosystem. For us at Oracle, we are proud to have one of the most complete human capital management platforms, providing all the capabilities from hire to retire. And at the same time, our platform is empowered by the latest innovations of emerging technologies. And by that, I mean the capabilities of artificial intelligence, advanced analytics, blockchain, and many others. Finally, I would like to share with you this case study about a New York-based hospital network that chose to go live with a new HR system for more than 37,000 of their frontline employees at the peak of the outbreak. The hospital wanted to deliver better HR and payroll solutions to their doctors, nurses, and first responders who were going through an extremely stressful time. They replaced multiple HR systems, including a 30-year-old payroll solution, with Oracle Cloud. This really proves the ability to outperform during COVID or during pandemic or during crisis times, and also proves the resilience of the cloud solutions and its ability to really reinforce and strengthen your resilient or resilience strategy. With this, I come to the end of my presentation. Thank you all. Please do not hesitate to post any questions, and we will respond back to you as soon as possible. Thank you.